Hi, this is my video of a clinical case that I had in clinicals. The chief complaint of the child was fever, decreased appetite, and lower back pain. His HPI is that this is a 6-year-old Hispanic male who presents with fever, a Tmax of 102 that started 1 day ago. Mom also says he's had decreased appetite and complaints of lower back pain that also started 1 day ago. She says he's still drinking fluids and having normal urinary output. She denies any vomiting or diarrhea from him. She's been giving him Motrin for the fever. The last dose was at 4 a.m. She does report that the fever will go down to about 99, but then, several hours later, the fever comes right back up. And then the mom also reports that the child has a sibling in the home that was sick with fever and vomiting 2 days ago. On his review systems, he's positive for fever, appetite change, and mom mentions that his activity level is decreased. He has no new rashes or lesions, denies a sore throat or runny nose, no headaches, no ear pain, no vomiting or diarrhea, no abdominal pain, but it's likely he does have nausea just given his decreased appetite. He is positive for flank pain, but denies dysuria frequency or urgency. And there's no cough. Mom denies any wheezing or shortness of breath. The child does not have any allergies, including drug and food allergies. He is currently just taking over-the-counter Motrin for the fever, but has no other current medications. No past medical history. He has not had any surgeries or hospitalizations in the past. So based on my HPI and review systems, my differentials at this time include a urinary tract infection, influenza, strep throat, and viral syndrome, which could include viral gastroenteritis. His vital signs when he came in were he was 100.4. His blood pressure was 112/69. Pulse was 121, and his respiratory rate was 20, and he's 99% on room air. He is 48 pounds, 6.4 ounces, and his height is 3 feet 11 inches, making his BMI 16.4. So he's at a normal weight and has had no significant weight loss since the last time that he was seen in the clinic. My physical exam is that he was very well appearing, did not appear dehydrated, no distress at the time, no rashes, no lesions, no dryness of his skin. Eyes were equal and reactive to light, no conjunctivitis, no runny nose. He does have a mildly erythematous pharynx. His tonsils were 2+, no exudate, and then his TMs were clear after we removed the cerumen from his ear via irrigation. His neck, full range of motion, no enlarged lymph nodes. His heart rate's regular, rhythm, no murmurs were heard. Lungs are clear to auscultation. He's got good movement, no increased effort of breathing. His abdomen is soft, non-distended. He didn't have any tenderness to palpation. No masses or organomegaly was felt, and he also had no CVA tenderness when we checked his lower back. He also doesn't have any edema on his extremities. So for lab tests, we decided to do a rapid strep, which was negative. We also did a rapid flu test, which was negative, and then We got a urine sample from him to do a urinalysis, which was normal. It didn't show any bacteria or nitrites, anything in the urine. So all of his lab tests were normal. So this made us come to the conclusion that his diagnosis is that he has a viral syndrome. And then for his plan, for medications, he doesn't require any prescriptions at this time. However, we encouraged the mom to give over-the-counter ibuprofen. She can give 10 milligrams per kilogram by mouth as an oral suspension every 6 hours as needed for fever, or Tylenol 15 milligrams per kilogram by mouth as an oral suspension every 4 to 6 hours as needed for the fever, and she can alternate the two. For non-pharmacological interventions, we just encouraged her to continue to push fluids in small amounts more frequently just to ensure that he stays hydrated. No referrals are needed at this time, and no diagnostic studies are needed at this time. And for follow-up and education, we discussed with the mom that his exam today is consistent with a viral illness, as his exam and labs that we did today were normal. There are no antibiotics that will help him at this time, so providing symptomatic supportive care is the best way for him to let the virus run its course. We encourage him to rest and treat the fever with over-the-counter antipyretics. In this case, guidelines were followed as the American Academy of Pediatrics, the AAP, recommends that antibiotics not be used in cases where conditions are viral in nature and you don't have any basis for a bacterial illness. So our guidelines were followed, and as I said before, supportive care is needed for the virus to run its course. And in evaluation or debriefing of this case, I agree with the plan and the diagnosis that my preceptor and I came up with. I probably would have classified this more as a viral gastroenteritis, just given the decreased appetite that he had, and even though he didn't have any vomiting, he had exposure to what was likely viral gastro from his sister. I think that my preceptor and I did a good job in collaborating to create a plan for this patient and to test him for strep throat, flu, and to do a IIA in order to help rule out our differential diagnoses. I feel that we covered our bases pretty well, and we were able to confidently come to a conclusion that the child just has a viral illness. Thank you.